So, what if I told you that most students get this stuff wrong on the exam, but you won't after today? It's true. Drug interactions are a huge reason people lose points, but we're going to fix that right now. Hey, welcome back to the PTCB Prep Guide. You know the drill. We take all that complicated pharmacy stuff and make it super simple. And today, oh man, we're diving into a big one: critical drug interactions. This is one of the most important and, most tested areas you're absolutely going to see on your exam. So here's what we've got on tap for today. We're going to cover the most life-threatening drug combos, the ones you absolutely have to know. Then we'll get into those sneaky food and supplement conflicts. We'll also touch on how drugs can mess with lab results in certain diseases. And most importantly, we'll talk about your job as the technician. And of course, we'll wrap it all up by looking at exactly how the PTCB is going to test you on this. Sound good? Let's jump in. All right, first up, life-threatening drug-drug interactions. We are starting with the heavy hitters, okay? These aren't just things you need to know for the exam. These are literally life or death situations in the real world. So you're going to want to pay super close attention to this next part. Okay, let's talk about warfarin. Seriously, if there's one drug to know inside and out for interactions, this is it. It's super, super sensitive. So look at this. You've got two major problems that can happen. On one side, you have drugs like Bactrim or ibuprofen that make warfarin too powerful. That means the bleeding risk goes way up. We measure this with the INR. A high INR means the blood is way too thin. Then on the other side, you've got stuff that makes warfarin weaker, which is just as bad, because now the risk of a blood clot goes through the roof. And let's zoom in on a classic one for your exam. I guarantee you'll see something like this. A patient's on warfarin and they come in to buy some regular old over-the-counter ibuprofen. Ding, ding, ding. That should set off alarms in your head. As a tech, that's a massive yellow flag. Why? Because that combo seriously ramps up the risk for a major GI bleed. You will see this, both on the test and in the pharmacy for sure. All right, here are a few more high-risk combos you just have to memorize. First, opioids plus benzodiazepines. This one even has a black box warning. Why? Because it can literally slow down a person's breathing so much that it stops. It's that serious. Next up, ACE inhibitors or ARBs with spironolactone. This mix can cause something called hyperkalemia. That's dangerously high potassium, which is really, really bad for the heart. And finally, if you mix a bunch of drugs that mess with the heart's rhythm, we call them QT prolonging drugs, you risk triggering a deadly cardiac arrest called torsades de pointes. So have you ever heard of serotonin syndrome? It's this really scary, potentially fatal condition that happens when there's just way too much serotonin floating around in the brain. The classic trigger you'll see on the PTCB is mixing an older antidepressant, an MOAI, with newer ones like SSRIs or even something like tramadol. When you see that combo, I want you to immediately think confusion, fever, and tremors. It is a full-blown medical emergency. Okay, look, some interactions are nuanced. This is not one of them. This is a hard no 100% of the time. PDE5 inhibitors like sildenafil combined with nitrates like nitroglycerin are absolutely contraindicated. I mean, do not pass go, do not collect $200. Both of these drugs lower blood pressure, so taking them together can cause a catastrophic, fatal drop. There is zero wiggle room on this one, ever. Here's another nasty one, rhabdomyolysis. It sounds complicated, but it's basically a very severe breakdown of your muscle tissue. And the classic PTCB trigger for this is mixing a statin with what's called a strong CYP3A4 inhibitor, like the antibiotic clarithromycin. So what does that mean? Just think of the inhibitor as something that stops the body's machinery from cleaning out the statin, so the statin levels just build and build and build up to toxic levels. This leads to massive muscle damage, so bad that it can actually cause the kidneys to fail. Okay, quick pop quiz. Let's see if you're paying attention. A patient who's taking warfarin gets a new prescription for the antibiotic Bactrim. So, what happens to their bleeding risk? Think back for a second. Yup, you got it. It increases. That antibiotic basically supercharges the warfarin, making it way more potent, which shoots up the INR and the risk of a dangerous bleed. Nice job. All right, let's switch gears a little bit, because it's not just other prescriptions that can cause trouble, right? We also have to worry about over-the-counter supplements and, believe it or not, even everyday foods. So let's talk about some of the biggest culprits you'll find in the supplement aisle. First, St. John's wort. This one is famous for making other drugs weaker, which can be a huge deal for things like birth control or warfarin. Then there's ginkgo and fish oil. These guys are kind of like mild blood thinners on their own, so mixing them with actual anticoagulants or even NSAIDs, yeah, you're just asking for bleeding problems. And finally, Kava and valerian. People take these to relax or sleep, but if you mix them with benzos or alcohol, you're going to dangerously multiply that sleepy, sedated effect. And what about just food? You bet. Grapefruit is the big one. It messes with an enzyme in your gut, which means drugs like statins and benzos don't get broken down properly. Their levels can shoot up to toxic levels. It's a huge deal. With warfarin, it's the exact opposite. Eating a ton of leafy greens, which are packed with vitamin K, can actually cancel out the warfarin, making it useless and putting the patient right back at risk for a clot. Oh, and don't forget dairy. The calcium in milk or yogurt can literally grab onto certain antibiotics, like tetracyclines, and prevent them from being absorbed. It's like the patient never even took the pill. All right, next section, lab and disease interactions. So now we're going to talk about how some drugs can totally mess up a patient's lab results, or how they can be flat out dangerous for people who have certain health conditions. This stuff is a little more subtle, but it's just as important for the exam. Okay, I want you to really focus on this first one here. Biotin. This is a hot topic on the PTCB lately, so listen up. Taking biotin supplements can give a falsely low troponin result, which means you could miss a heart attack, and it can totally screw up thyroid tests. Then there are beta blockers. For a patient with diabetes, this is critical. Beta blockers can hide the symptoms of low blood sugar, which is incredibly dangerous. Knowing these details is what separates a good technician from a truly great one. And here are some straight-up, non-negotiable rules when it comes to drugs and diseases. For a patient with asthma, a non-selective beta blocker like propranolol? Absolutely not. It can trigger a bad asthma attack. Patient with heart failure? No NSAIDs. They make fluid retention worse. And of course, pregnancy. There's a whole list of drugs that are a huge no here, like ACE inhibitors, statins, warfarin. You get the idea. These are hard stops. Okay, wow, that was a lot of information, right? So what does this actually mean for you when you're the one working in the pharmacy? Let's boil it all down into a super simple step-by-step plan. It really all comes down to this simple 3-step protocol. Step 1, identify. You see one of the red flags we've been talking about. Step 2, flag. You stop everything and you flag that prescription in the pharmacy's computer system. And step 3, the most important one, alert. You immediately go tell the pharmacist what you found. That's it. Notice what's not on this list? You don't dispense the drug. You don't try to counsel the patient yourself. Your job is to identify, flag, and alert. That's the protocol. And following it literally saves lives. All right, so you know the dangerous combos and you know your protocol. Let's put it all together and see exactly what a question on the PTCB is going to look like. Okay. Here's a perfect example of a PTCB-style question. A patient comes to the counter and hands you 2 prescriptions, one for sildenafil, the other for nitroglycerin. What is the very first thing you should do as the technician? As soon as you see those 2 drug names together, a giant red alarm should be blaring in your mind. And the answer is, of course, you immediately flag those prescriptions and alert the pharmacist. The why here is the most important part. You know that this combination is an absolute contraindication. Why? Because of that risk of a fatal drop in blood pressure. See, the exam isn't just checking if you've memorized a rule, it's checking if you know the safest action to take to protect the patient. That's the key. I know we covered a ton today, and if you're feeling a little overwhelmed, that's okay. Just focus on this. If you only remember a handful of things from this whole lesson, remember these. Warfarin interactions, opioids mixed with benzos, nitrates with drugs like sildenafil and grapefruit. Think of those as your top-tier, biggest red flags. If you see any of them, just get in the habit of pausing and double-checking. That one habit will make you an amazing, safe technician, and it will help you crush these questions on the exam. And there you have it. Let's do a quick recap. You now know the highest risk drug interactions out there. You know the critical safety checks that are your responsibility, and you are so much more prepared for these questions on the PTCB exam. Hey, if this lesson helped you out, do me a favor and hit that like and subscribe button. It really helps the channel keep making more of these simple lessons for everyone. Always remember, keep it simple, keep it safe, and I'll see you in the next one.